Hi, today we'd like to continue on our PCOS series discussing treatment and diagnosis at Antai Hospital. And today's topic we'd like to focus on PCOS and the use of IVF in its treatment, specifically the misuse or the wrongful use of IVF. So first of all, we'd like to talk about PCOS before we go into the topic. PCOS is caused by the presence of abnormal testicular tissues that's not supposed to be in the ovaries but are present, causing the high levels of androgens, testosterone within women who develop them, and they develop these symptoms associated. And furthermore, when they get married, when they begin their fertility journey, they're unable to get full-term pregnancy, they're experiencing recurrent miscarriage, and in severe cases they might experience infertility. So we're on the topic of infertility. When many patients go for diagnosis of PCOS, they go for PCOS diagnosis only because they're unable to get pregnancy, they're unable to get pregnant. But since PCOS is present since you were young, they did not seek early treatment in their early 20s, 30s. They only seek the attention and they put emphasis on it when they are unable to get a pregnancy. So when they go for this diagnosis on their treatment, they are actually getting diagnosed for infertility. And many doctors, when they encounter infertility, immediately they will recommend you to go for IVF instead of giving you a proper diagnosis as to what's exactly causing this, and then give you the proper treatment. As we all know, IVF is not a treatment method. It is simply an assistive technique that allows you to get pregnant, assists you in getting pregnant, but it's not a treatment method. It does not solve any underlying root causes of your condition. So when these patients, when they go for IVF, they still are unable to get pregnant, still they experience miscarriages, and not only do they waste resources of time, they spend a lot of money as well, because IVF is very expensive. They end up losing time, end up losing a lot of money, using up all their savings, and they end up missing their fertile periods because they are experiencing failure after failure, and then they end up being in their 40s. Now pregnancy is even much more difficult. They need to go for adoption. So to avoid all that, first of all, we need to talk about why IVF is not suitable for PCOS. First of all, it is not a suitable indication. What I mean by that is that IVF is only specific to tubal disorders, infertility caused by tubal obstruction or tubal disorders, any problems with the fallopian tube. For example, if there's a missing fallopian tube, if there is a swollen fallopian tube, if there's an obstructed fallopian tube, if there's a torn fallopian tube, these indications all are perfect for IVF. These patients, when they go for IVF, they will see a high success rate. However, for anything other than that, if you still go for IVF, you may encounter failure because IVF is only specific to tubal factors. Infertility caused by PCOS is an ovarian factor because they are experiencing ovulation blockage, ovulation disorder. They're not ovulating properly, and even if they ovulate, these follicles are not high quality, so eventually it will lead to a miscarriage. So first of all, the indication is already inaccurate, so you're only moving towards failure. Secondly, the use of IVF. Many of these patients are actually prescribed a lot of hormones to help them ovulate and induce ovulation so that they can acquire several follicles to prepare for IVF. So during one collection of follicles, they will take up to 10, 15 follicles, and in order to do this, they will need to give several injections or even oral medications. All of these are exogenous hormones, including FSH, follicle stimulating hormone, the most common one. And PCOS itself is already a hormonal imbalance, a chronic hormonal imbalance disorder. So when you introduce even more external hormones, you are only setting yourself up to failure because you're actually messing the internal balance even more, making it much more severe. And being under these conditions, when your hormonal imbalance is very unstable, it's very severe. During these states, if you sustain a pregnancy, it can be very difficult to sustain it to full term. Very likely it will lead to another miscarriage. And thirdly, let's talk about the success rate as to why IVF is a low success rate. Now, this is something that your doctor won't talk about, but consistently IVF success rates sit at around 25 to 33% because many of the times it's not accurate to the indications. Because again, we'd like to say that IVF is not a treatment method. So many patients view IVF as a one-for-all treatment that can secure a pregnancy for them. If they are experiencing miscarriage or infertility, IVF can solve that problem. That is a misconception. Again, IVF is only specific to tubal factors. And if you do not go for proper diagnosis, or if you are misdiagnosed, you don't get a second opinion, very likely that you will be on this journey of potential IVF failure or potential pregnancy failure, of several miscarriages as well. So with these three key points in mind, the proper way to actually overcome infertility caused by PCOS, first of all, need to go for proper diagnosis. Find out what is actually causing the infertility before directly going for IVF. Because many of the times it can be treated. And then after treatment, you can actually go for natural pregnancy. You don't have to spend so much time and money on IVF because that will take a while as well. If you receive the proper treatment at a lower cost, you can save time, save money, and you can have natural pregnancy. There's a lot of benefits to that as well. So at Antai Hospital, once we diagnose your PCOS, treatment is straightforward, which is a laparoscopic surgery. And we've done this for over 2 decades now, and we can ensure a 95% success rate. So treatment is that we will be removing these abnormal tissues that are causing all these symptoms, the infertility, miscarriage. This surgery does require experience and expertise. At Antai Hospital, we can provide you that. And once we accurately remove only the abnormal tissues, these testicular tissues that are fused deep inside your ovaries, then you can see your symptoms subside, your ovulations come back to normal, and you can go on for a natural pregnancy. So if you'd like to find out more information on how to achieve natural pregnancy, overcome your infertility caused by PCOS, please visit the website, read our articles, watch our videos, and let's set up a consultation to discuss how we can help you on your fertility journey.